We chose this topic because we would like to bring this to your attention, and more importantly, we would like to raise the awareness, to raise the consciousness of our policymakers and other key development actors on this important issue, so that it will not be relegated to the sidelines as we continue to combat the COVID-19 pandemic. To start our webinar, I'd like to call on our President, Dr. Celia Reyes, for her opening remarks.
Thank you, Sheila. Good afternoon, everyone. I'd like to welcome our guests, colleagues from the government, representatives from the academe, civil society, media, and the private sector to our webinar this afternoon. This is our second webinar for the month, and thanks to new technologies, we're able to share information and interact with one another remotely. Of course, this would not have been possible without our tireless webinar team led by Dr. Sheila, Siar. They're in the office right now despite the work from home arrangement for us to deliver this webinar. Today's conference will be focusing on a very timely topic, as Sheila has mentioned, vaccination. So in the midst of a pandemic, actually the world is struggling right now to find a vaccine for COVID-19. Today, PIDS Research Fellow Valerie Gilbert Ulep will be presenting the paper that he and Ms. Jhanna prepared, titled Too Early, Too Late, Timeliness of Child Vaccination in the Philippines. Dr. Ulep will discuss the results of their assessment of the implementation of the expanded immunization program in the Philippines for the last 25 years. Every year, we observe the World Immunization Week in the month of April to promote the importance of giving vaccines to people, both young and old, to protect them from diseases. According to the World Health Organization, in 2018, an estimated 19.4 million infants worldwide were not reached with routine immunization services, such as 3 doses of DTP vaccine. Around 60% of these children live in 10 countries: Angola, Brazil, the Democratic Republic of the Congo, Ethiopia, India, Indonesia, Nigeria, Pakistan, the Philippines, and Vietnam. So based on WHO data, immunization coverage in the country has been declining. For instance, the DTP3 immunization coverage among 1-year-olds, or the percentage of 1-year-olds who have received 3 doses of the combined diphtheria, tetanus toxoid, and pertussis vaccine in a given year, has declined from 79% in 2010 to 65% in 2018. Moreover, the polio immunization coverage among 1-year-olds has declined from 78% in 2010 to 66% in 2018. The percentage of children under 1 year of age who has received 1 dose of measles vaccine has also gone down from 80% to 67% during the same period. Last year, the UNICEF reported that there were about 2.9 million unvaccinated Filipino children, which makes them vulnerable to life-threatening diseases. According to UNICEF, the childhood immunization coverage in the Philippines has been dipping sharply in recent years, exposing children to vaccine-preventable diseases such as measles and polio. In fact, in September last year, the WHO declared a polio outbreak in the Philippines, putting children at risk of lifelong paralysis. Moreover, the DOH, Department of Health, reported more than 4,000 measles cases, with 70 deaths in the first quarter of 2020. And there are several causes of this drop in immunization, and Dr. Ulep will be presenting this in his talk. And some of these were public hesitancy, vaccine stockouts, shortage of trained workers, and accessibility of far-flung areas. This year, with the COVID pandemic, UNICEF estimates that about 2 million Filipino children may miss out on immunizations, and this is quite alarming. To address this concern, the DOH has issued Department Circular 2020-0167, which mandates hospitals to continue providing essential services to the public, such as the routine immunization for children 0 to 12 months. And the government has also reiterated various laws and policies to ensure that each every child gets vaccinated on time, even under this pandemic period. Under Republic Act 10152 or the Mandatory Infants and Children Health Immunization Act of 2011, basic immunization are given for free to infants and children up to 5 years old at government hospitals and health centers. The question now is how can we expand the vaccination coverage and prevent preventable diseases? Again, we thank you once again for joining this webinar, and we look forward to hearing your insights during the open forum. Thank you.
Thank you very much, Ma'am Cel. Before we continue, allow me to give you to tell you all about our house rules for the efficient conduct of our webinar. First, we will entertain questions during the open forum. So please reserve your questions while the presentation is ongoing, and we will accommodate them during the open forum. Second, in case you would like to ask a question, just use the chat box, which is located at the lower part of the screen. So just type your question and your comment, as well as your name and affiliation, and I will call you during the open forum. And third, please be informed that we are recording this webinar for documentation purposes, and it is possible that we will share the recording through our website and social media pages. Okay, so allow me to introduce the authors briefly. So as Ma'am Cel has mentioned, the presentation, the paper is authored by Dr. Val Ulep, and his co-author is Ms. Jhanna Uy. Dr. Val Ulep is a research fellow at the PIDS. Prior to joining the institute, he worked at the DC and Delhi offices of the World Bank, and he has a PhD degree in health policy and economics and a master's degree in epidemiology. Meanwhile, Ms. Jhanna Uy is a supervising research specialist at the PIDS, where she conducts research on health systems, reforms, and policies. She recently obtained her master's degree in epidemiology from the Harvard School of Public Health. And well, that's it. Over to you now, Val, for your presentation.
So thank you, Ma'am Sheila. Thank you, Ma'am Cel. And good afternoon, everybody. So I'm going to present to you our paper that was released, I think, 2 months ago. So the title of the paper was Too Early, Too Late, Timeliness of Child Vaccination in the Philippines. So I co-wrote this with Ms. Jhanna Uy, one of our supervising research specialists. Next, please. So before I go on with the presentation, I just want to emphasize that this paper is a part of a bigger project of the Philippine Institute for Development Studies with the Department of Health, trying to evaluate the performance of the National Immunization Program. So again, this is just a small piece of the pie. So in the next few months, we want to release more assessment on different domains of the National Immunization Program, like supply chain and logistics and the demand side domains. But this one, I just want to emphasize that we're only looking at the performance in terms of coverage and in terms of timeliness. So what is vaccination? So vaccination is one of the most important public health intervention in the last century, I would say. The drastic improvement or the drastic decline in infant mortality, the improvement or the vast improvement in life expectancy can be attributed to vaccination. Of course, there was rapid improvement in sanitation and in other forms of medical technology, and of course income. But vaccination, if you look at empirical studies, is the main driver of improved health outcomes in the last century. So the effectiveness and the importance of vaccination should not be anymore, we should not debate anymore about the importance of vaccination at this time. So So around 3 to 5 million deaths are prevented because of vaccination. Right? The elimination of smallpox, for example, is a good example of the importance of vaccination in global public health. Next slide, please. Next slide. So just a brief background about the EPI, or the Expanded Program for Immunization in the Philippines. So EPI is one of the major public health programs of the Department of Health. So in 1974, the World Health Organization established the EPI, calling countries to expand immunization programs. And in 1976, the Philippines adopted EPI, like 2 years after the WHO introduced EPI. So EPI in the Philippines has a long history. So it's like 40 years. And that is important to, when we evaluate the EPI, we need to consider the history behind the EPI. So the long history has, created a lot of institutional memory and and institutional memory and develop the systems within the bureaucracy of the Department of Health. So when you want to look for reforms, we need to understand that long history of EPI. So the EPI, the importance of EPI was again re-echoed in the Republic Act 1052, as Ma'am Sheila said, of 2011, which mandates the government to actually provide free routine vaccination for 11 diseases. Next slide. So I want to go through the implementation arrangement of EPI in the Philippines. In the last 40 years, based on our assessment, there was no drastic changes in how we deliver the program. So of course, there was changes in 1991 when we developed the health system, right? But now the way we implement EPI is in a highly devolved system, right? So the Department of Health, the central office, serves as the regulatory and advisory body, provide technical support and capacity building to local government. So the central office centrally procures all the vaccine and manages the supply chain and logistics to be given to the local government units. So the local government units cover the operational expenses to deliver immunization program services free of charge at public health facilities. Although, if you look at a lot of assessment, there were also deviations from this. Like for example, the LG will pay for the syringe, etc., and sometimes the national government will also pay for that. So there were like variations over time. But basically, the central office procures the vaccine, and the local governments will basically deliver it in public health facilities. So the EPI is not in general are not introduced in private facilities. Meaning, so if you are an individual who wants to go to a private clinic and want your child to be vaccinated there, you need to pay out of pocket. So that's how it works. So the EPI is only at the public system at this point. Next slide. So a brief background again on important milestones in EPI in the Philippines. So in 2010, in 2000, the Philippines eliminated polio after so many years of cases, right? And in 2017, we also eliminated maternal neonatal tetanus. And also one important milestone is the expansion of fiscal space for the EPI, meaning that the government actually allocated more money in the program. So for example, and that's because of the sin tax laws. So in 2012, there was so the government decided to earmark the revenue, a portion of the tobacco revenues or tax revenues to DOH, and the DOH decided to put a lot of that resources to public health programs, including immunization. But currently, So we are also doing a second round of analysis on this one, and we're trying to tease out the type of spending. So and what we've noticed is that although the total budget of EPI increased, the budget for routine vaccination, despite the increasing number of children in the Philippines, are not actually increasing. They are actually so the additional budget given to EPI was because the government decided to expand more or to include more vaccines like pneumococcal vaccine. But I think the basic routine vaccination, I mean, if you look at the budget, it didn't change over time. So if you do it per capita, you would see maybe also a declining public spending for routine vaccination. But those findings will be in the next round of evaluation. Next slide, please. So I'm going to discuss two issues on the performance of NIP, right, for the immunization program. So for me, there are two critical issues that we need to think about. So number one is that the government, if you look at in the last 25 years, the government has really struggled to maintain vaccination coverage level and to reach medium-term national target of fully immunizing 95% of children. Despite the increase in budget, despite all the efforts, we are really struggling to sustain high coverage rate. So the Department of Health, the target is 95%, or all children should be fully immunized. So 95% should be fully immunized. But we are really having a hard time reaching that target for some reason. And with that, the large declines or the large decline in vaccination coverage over the last 25 years. I mean, it's like there were waves of increase and decrease. Resulted to some outbreaks, right? Like for example, we had polio outbreaks in the last 5 years, and also measles. So the idea there is that the vaccination coverage was not really sustained, and the hypothesis there is there's really something wrong with the system, right? The fundamental the fundamental nature of the program. So next slide, please. So before I move forward, maybe I need to elaborate some important concepts of coverage and timeliness. So in traditionally, one way to measure the performance of a national immunization program is to look at the coverage, right? Like in many countries, the WHO or the World Bank uses the coverage rate, right? So how many children are covered, right? Irrespective of immunization schedule. But here we try to look at timeliness, like how timely are we vaccinating our children, right? So the Department of Health has this vaccination schedule that parents need to abide, right? So we want to look both important measure, coverage and timeliness. They are interrelated, but they are they're two separate issues. You can have high coverage but low timeliness. So a lot of countries and a lot of empirical work have shown that many countries exhibit that kind of duality, right? High coverage but low timeliness. For example, US, right? So they have high coverage, 90%, but timeliness because they want to delay it. So they have low timeliness compared to a lot of OECD countries. So the importance of looking at this is that if the vaccination is too delayed, the child is more at risk of infections, right? And if it's too early, if you look at the empirical studies, it will lead to weak or suboptimal immune response. So that's the reason why we want to look at both measures, coverage and timeliness. Next slide, please. So just to give you, just to present the vaccination schedule from the Department of Health. So these are the vaccines that a child needs to have before the age of 1. So I will not go through it, but basically, um, 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 it's yeah. So there's BCG, Hep B, pentavalent, OPV, IPV, PCV, MCV, and MMR, trying to avert all these all these kinds of diseases. Okay. So next slide, please. So what is the objective of the study? So the objective of the study is to examine the immunization coverage and the extent of timely vaccination among children aged 12 to 24 months in the last 25 years, from 1993 to 2017, for the following basic vaccine considered to be part of routine basic vaccination for children. So BCG, OPV for polio, DPT, diphtheria, pertussis, and tetanus, and measles. So as I've said a while ago, there are other parts of vaccine included in the EPI, but we did not analyze. We did not include that in the analysis. We just wanted to focus on the routine child vaccination. Next slide. So yeah, so some definitions of terms. So what is coverage? So coverage is the proportion of children aged 24 who were immunized with each vaccine. So we'll have coverage for each type of vaccine as recorded in their vaccination cards or as reported by mother's recall, regardless of timing of immunization. So again, we do not consider the timing of immunization. So when you say basic vaccination coverage, this is the proportion of children aged 12 to 24 months who were recorded or reported by mothers to have received all the 8 doses of the basic routine child vaccination. Next, please. So when you say timeliness, so this immunization was considered timely if a child received the vaccine according to national immunization schedule, recommended range age for the vaccine and dose. So these are the vaccine and the recommended age. So these are the recommended age of administration. So for example, BCG, you need to give the child before 2 weeks after birth, right? So OPV1 from 6 to 8 weeks. From OPV2, it should be given from 10 weeks to 16 weeks, etc. So next slide, please. So basically, the methodology here is we just pulled the national demographic and health survey from 1993 to 2017 and examined the age cohort. So we also use Kaplan-Meier method or a kind of survival model to look at the cumulative coverage rates, which I will present later on. But I will not go through the method anymore. But next slide, please. So here are like some of the results. So using the National Demographic and Health Survey, we tried to calculate the coverage rate by cohort here. So we look at BCG, OPV1 coverage, DPT1 coverage, DP3 measles, then OPV complete. So for the OPV complete, if you have 3 of the OPV doses, and I want you to focus on the basic vaccination, which is all doses of routine child vaccination. So one of the things that we need to see here is that so we have a 95% target, so we haven't reached that. So if you look at the basic vaccination, you would see that there was really an unsustained growth. So there was an erratic growth, I would say. So the highest peak was in 2016 when the basic vaccination coverage was around 80%, more than 83%. But after that, there was already a declining trend in basic vaccination, and we've already started to do some key informant interviews to understand what happened in the system. And I don't think we haven't really published the paper, but in the next paper we will tried to explain why there was a systemic decline in 2006 to until 2014, right? So and the most interesting thing here is that the vaccination coverage for, at least for, I mean, for basic vaccination, the lowest point was in 2014. So so this is also very alarming to us that the decline was really, even there was some demand side problems like vaccine hesitancy, but in 2014 there was already like very significant decline. So again, um, we also did a lot of informants to actually investigate what happened to even before the demand side problem. In 2014, there was a recovery in 2015 and 2016. But when you look at the data again in 2017 using other sources, there was really a decline again in 2016 and 2017 and 2018. And yeah, so for 2020, you would expect large decline, like super large decline because of the pandemic. So again, it will be a trend, I mean, sustained growth in the next the whole decade, I mean, for the whole decade. So next slide.
Val, hello? Val? We lost you? There seems to be
So,
a
okay.
connection
So this is the
problem.
vaccine. Can you hear me?
Yes, we lost you for a while. Yeah. Please go ahead.
Okay. So this is the vaccination coverage. This is the vaccination coverage by region. And sorry for because it's a bit small, but I think the idea here, or the intuition here, is that you would see like almost all regions have declining trend. Using the latest survey, I mean, for example, Soxergen has very alarming decline. ARM is also declining.
Business operations and strategy associate, but it's just really a catchphrase to whatever NAGA needs help with.
Hello? Yeah, so, and like regions like Western Visayas also registered large decline. Hello, can you hear me?
Yes, Val, we can hear you.
Okay. So someone messaged me that it's a bit unclear, but yeah. So yeah, so that's the vaccination coverage by region. So just be mindful about the large declines in almost all regions. Next slide. So yeah, it's also important to benchmark our country, or I mean our performance with other countries. So here, apparently, if you look at low income countries, it's actually the coverage rate for low income countries, at least for DPT3, is actually higher than the Philippines. So we went global. So just global average, you would see that the global coverage for DPT3 is a bit sustained, but the DPT3 in the Philippines, you would see erratic decline. I mean erratic trend. And in 2018, you would see large drop again in the coverage of DPT3, one of the basic routine vaccination. Next slide. Like how about if we compare ourselves? I always want to compare ourselves to other countries. What if we compare it to our regional peers in ASEAN? So you would see here that successful countries like Thailand, Singapore, and Malaysia have a sustained growth in the DPT3 coverage rate, right? But in the Philippines, you would see again an erratic trend to the point that in 2018 you would see that we're now in the lowest in the region. where like countries like Laos, for example, or Laos or Cambodia would have a better immunization coverage rates. I mean, despite the lower GNI per capita. Next slide. So let's go to the timeliness, right? So we calculated the timeliness, and like let's go with BCG. So here, so what's telling us here is that in BCG, at least for the coverage rate for BCG, around 90% of children are vaccinated with BCG, but only 64% of them are timely. About 34% are late. Next slide. But if you go to other forms of vaccination, you would also see large, like for example, the coverage rate for OPV in 2017 is 87, but only 40% of them are timely. Yeah, next, OPV2. Same thing here. So the coverage of OPV, we see that the coverage rate is high. I mean, relatively high, 85%, but 61% only are timely. 81% only timely vaccinated. And DPT, same here. As you go with the second or third dose, the coverage obviously will decline, but the timeliness will also increase. So the coverage rate of OPV is around 78%, but 66% are like only 66% or 67% are timely. Next for DPT1. So yeah, so the coverage rate for DPT1 is 86, but only 37% untimely, so 38%. So DPT3, so I didn't include DPT2, but for DPT3 you also see the same pattern.
Well, hello.
Hello?
Yes, yes.
Sorry. Okay, that's the DP3. So that's the coverage rate is 78% or 79% in 2017. But the timeliness is only 64%. I mean, 64% are timely. Next slide. So this is basically the coverage rate using Kaplan-Meier. You would see. So I think I want to emphasize the red. So the red line. So and the two bars are the recommended age, right? So you would see that a lot of children are not vaccinated on time, right? Basing on that red line. And if you look at it over time, right? Like there was no improvement in coverage rates, except at least for BCG, you would see that there was an increasing coverage rates within the recommended age, but for most vaccines, you would not see any improvement in 2017. Next slide, please. I think to summarize that in a very simple terms, so the basic vaccination in the Philippines is 69%. Like, so if they have all the routine child vaccination, they completed all the doses, around 70%, right? But of that, only 10% are actually timely. So they have basic and all timely vaccination around 10%. So, and to us, I think that is very, very, very small. Next slide. So we also try to examine the vaccination coverage over time. And what is alarming here is that, like, if you look at all socioeconomic status, you would see a declining trend. So from the bottom 60%, from the middle 20%, even from the top from 2013 to 2017 survey years. What is interesting here is that even the top 20% are actually, like if you look at the rate of decline among the richest households, you would see like super large decline compared to at least bottom 20, bottom 60 or bottom 20, middle 20%. So again, this is an important hypothesis on what's really driving why even the rich segment of the population have low coverage rate or declining coverage rate. Next slide, please. So yeah, so we also examine the place of immunization, because when I was discussing a while ago that most of the EBI are in the public system. Because to us it's very alarming that if you look at other interventions, so other health interventions, you will see large gradient, meaning that for example iron utilization, you would see large difference between the rich and the poor in terms of utilization in private or public facility. So our hypothesis here is why even the richest quintile are actually using the public system, except for other vaccines like OPV, yes, or DPT3. But if you compare to other like for example iron, you would see larger gradient or variation. So yeah, so if you look at BCG, majority of children are getting their shots in public system, right? Despite the increasing stock of private facilities, so we are still getting it from the public system. Next slide. So I just want to like summarize the result is that, so in the last 25 years, basic vaccination coverage has never reached 95%. So, which is our actually target. So the highest peak for basic vaccination was in 2006. The lowest peak was in 2014. So the lowest in 25 years. So unlike in other countries where there's sustained growth in coverage, there's a the coverage rate over time in the Philippines is characterized by large fluctuation. So it's quite unstable over time. And again, it boils down to looking at the system that currently we have, right? That we haven't really changed since the inception of the API. So I think the next goal really of this evaluation is to really look at ano yung hindi natin ginagawa that lead to like unstable coverage rate. Are there really something wrong on how we deliver the supplies, etc. For us to see these fluctuations, right? Because any disruptions in the supply side, you would see like drastic decline, right? If you would see, if there is failed bidding, for example, you would see again, like this year, you would see large decline. So I think that the idea there is how do we make sure that there is the system in place is also sustainable and predictable to ensure that coverage rate is actually sustainable. So those questions will be, I think, can only be answered by thoroughly examining, through key informant interviews or through examining financial financial data or supply chain data, which we're trying to do in the next round for analysis. So I think the instability of the coverage rate is very, very alarming, the unpredictability. Next. So depending on the vaccine, only 38 to 65% of immunized children had timely administration within the recommended age range of the national immunization schedule. So only 11% with basic timely vaccination. And if you compare this to other countries, this is a bit low. We try to look for other countries. Next slide, please. To at least compare timeliness. The problem is that studies on timeliness of vaccination is still growing. Like only few studies have only few researchers have conducted this. So when we did like some big review, we found this. Like for example, in Kenya, the timeliness of vaccination for BCG is 80, ours is 65, right? Like those things. So you would see that comparing to others countries, the level of timeliness is actually very low when you at least compare to other countries. The problem is there is no benchmark on timeliness, although the empirical studies are growing, but there is no benchmark yet on when to say, okay, you're untimely. Of course, there are also debate that on catching up vaccination and things like that. But to us, it's important that the timeliness is an important measure of supply side issues. Next slide. So again, another important finding is that although the difference in immunization coverage are large, the timeliness between the poorest and the richest is not actually very significant. And the hypothesis there is that because the EPI is driven mainly by the public system, that's why you wouldn't see large inequality, right? Like, and although it still needs to be evaluated, but those are our hypotheses why there is really like smaller gradient compared to other health services like iron or diarrhea services, etc., where you would see super large variation between the rich and the poor, between the use of public and private system. But in vaccination, you don't see that large variation. So next. So yeah, in the succeeding rounds of the evaluation for the national immunization program, we are trying to evaluate these different domains. So as the one I presented looks at the coverage and timeliness, but in order for us to really understand what's really driving these two important variables, can be supply side or demand side issues, which we are trying to. I mean, in the next rounds, we are trying to complete all this, trying to come up with a more comprehensive picture of the national immunization program. Next slide. Next slide, please. So, in terms of recommendation, it's really hard to make recommendations because we want to have a complete or more comprehensive understanding. But I think the important lessons here, general lessons that we need to understand, that EPI should aim for both high immunization and timely administration of vaccine. Now, we are only focusing on, if you look at, for example, the national objectives for health, it's always coverage. But I think it's timely to examine the timeliness of administration of vaccine. Some countries have started doing that. And I think it's also important to start looking at some large invested in health system reforms, on how we deliver, how we finance, and how we govern the vaccination program in the Philippines. I think the UHC started to think about on how we really, on how do we, what are the path-breaking reforms to actually um, um, like unshackle the old ways of delivering and financing the program. So I think we've started to discuss this with the Department of Health. Um, um, but I don't know what will happen because of the pandemic. But I think there were already options on how do we really shift the system to change on how we finance and how do we deliver API in the country. And the third one is that I think we also need to think about expanding the API to the private facility as an important conduit or channel for delivering um, um, immunization programs. So I've seen a while ago, most of the way we do things is in the public system, and I think that is fine. But I think we are actually losing an important avenue or conduit or channel to deliver the 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 vaccination program, because as I've shown a while ago, even the richest quintile is actually suffering from large decline in vaccination coverage. And to us, it can be both demand and supply side issues, right? Um, one of the findings, for example, is that even in private clinics, vaccines are very, very expensive. That even the richest quintile cannot even, or the middle class cannot even, cannot even, you know, uh, um, cannot um, pay for it. So I think those things are the general recommendation at this point. Uh,
Val, hello. Hi, Val. Val. We lost our speaker, but I think that's already his penultimate slide, right? Val, hello. Yeah. Um, okay, that was actually already his last slide. We will again call our speaker once. Yeah, he already joined us.
Hello,
Yes, Val,
hello.
we
Sorry.
lost you. We lost you.
So sorry. So those are the three general recommendations, and I hope as we move forward, so I hope as we move forward, I hope um, we get some insights from the audience as we as we as we move forward with the next chapter for the evaluation. And because also the Department of Health is also very excited, I guess, um, to receive our recommendations and how do we really move, or how do we move the system to um, improve vaccination coverage. I don't think the way we do things is the way we really need to change it. And I think when I say we need to change it, like it needs a lot of like overhaul on how we finance and deliver it, and how we involve the private sector in the picture. Right? So yeah. So in the next few rounds of this, I mean the next few chapter, I guess in the evaluation, we will have a more comprehensive assessment when we examine other domains of the program. Thank you.
Thank you very much, Val, for your comprehensive presentation. We will let you catch your breath for a short bit before we start entertaining questions. At this point, please allow us to first acknowledge the representatives from the different agencies who took their time to attend our webinar this afternoon. We would like to thank the representatives from the Commission on Population, Department of Health, National Anti-Poverty Commission, the Congressional Planning and Budget Research Department of the House of Representatives, Waseda University, Health Polytechnic Palangkaraya, Consuelo Foundation, Hope Worldwide Philippines, Norfield Foundation Cebu, the Pharmaceutical and Healthcare Association of the Philippines, the Philippine Foundation for Vaccination, the Philippine Legislators Committee on Population and Development, UNICEF Philippines, World Bank Philippines, and the World Health Organization, also our research fellows and the management committee at the PIDS. Thank you so much for participating in our webinar this afternoon. We are now ready to entertain questions, and but before that, in case you missed our house rules, if you have any question or comment, please use our chat box. Just type your name and affiliation, and if you could also include your question or your comment, and I will call you in this session, which is already the open forum. So our first question is from Dr. Celia Francisco of Save the Children Philippines. Dr. Francisco, please go ahead.
Good afternoon.
Thank you, ma'am. Please go ahead with your question.
Okay. Thank you very much, Dr. Ulep. It was really, I mean, we were expecting these results, okay, but now we have the numbers. So it's really very, very enlightening, not to see all these numbers supporting what we were suspecting, okay. My question, as I wrote in the chat box, is that if you are going to compare the timeliness, no, of each vaccination, I noticed that both OPV1 and the DPT1 had the greatest delay, no? Like, as I recall, it's OPV1 is 39.5%, and the other one, DPT, is 37.5%. But then, for OPV2 and DPT2, the timeliness rose to, although it's not ideal, but it rose to 60 to 61%. And then for DPT3 and OPV3, also 60 plus. Okay, so obviously it's in the DPT1 and the OPV1 where you find the greatest delay. And so, I mean, what could, if we were to analyze what could possibly contribute to this? So they delayed the DPT1 and OPV1, but then when it's time for DPT2 and OPV2, some of them came on time. Also for DPT3 and OPV3, no? So we'll have to look at this data in more detail, no, greater analysis, because it provides us with it can spring to a lot of recommendations, no, as far as I mean, is it supply driven, or why is it that, for example, if it's the demand which is low, are the mothers not very keen on bringing their children at 1.5 age? So why is that? When it comes to bringing them at 6 to 8 weeks or 14 weeks to 24 weeks, they're capable of doing that. So those things are to be seen in a granular situation. No?
Thank you very much, Dr. Francisco. Let me call first Dr. Wigdan from UNICEF, because his question, his comment is related to the one expressed by Dr. Francisco. Dr. Wigdan, please. Dr. Wigdan?
Good afternoon, everyone. Thanks, Val, for the presentation. My question is first, like, the analysis also include the level of education of the mother, the caregiver, the education level, because sometimes this also has impact on the behavior and the understanding also of the importance of immunizations and the timeliness of it. The other questions, did you also investigate the reasons for the delays to timely immunizations? Is it related to the mother awareness? Is it related to, as the colleague mentioned, supply, vaccines, other issues? And working very closely with the DOH on these issues, now we have like a grasp of understanding the bottlenecks and constraints in the health system that's really hindering the achievements of the high coverage and also the timeliness required. But it will be good during your study really to look at all the health system aspects, the supply, the demand side, look at the enabling environments and also human resource. And the recommendations also, as you have mentioned previously, is to look to the financing because yes, there is increase in the budget, but as have been indicated by you, it's mainly for procurements of vaccines. And really DOH are struggling to fund even simple activities for the ETI, like trainings, capacity building workshops, even some simple operational costs to conduct some outreach activity that's really critical to achieve the high quality. Over to you. Thank you.
Thank you very much, Dr. Widan Madani of UNICEF Philippines, and also to Dr. Cecilia Francisco of Save the Children Philippines. Val, your response, please.
Yeah. Thank you, Ma'am Cecilia and Wichna. With regard to the question of Ma'am Cecilia, I think it's a very good question, Ma'am, but it might be really hard to to get the answer from the survey. But you're right. I think that's why we are trying to do more key informant interviews, and we've started doing that for the next phase of this evaluation to understand why we see these patterns, right? And to be honest, I don't know really the answer because you're only looking at the macro data, but to explain why we see this shift or very conspicuous pattern. I think we need more in assessment or investigation. Um, we tried to do some a more elaborate regression model to actually understand what's driving these timeliness variables, but we are only looking at like the usual suspect like age, um, socioeconomic status, etc. But going back to Wichtan's comments, looking at how the different components of the health systems interact um, with 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 each other and affects coverage and timeliness. We will try to do that in the next phase of the evaluation because it needs a lot of thinking and evaluation of administrative data and especially from the DOH. So yeah, I'll note down. I already noted down all your comments. So I hope we could answer that in the next round of the assessment.
Thank
Over,
you,
Ma'am
Val.
Sheila.
Yes. How about the question of Dr. Wigdan? It's if the analysis could also include the level of education of mothers or the caregivers and the reasons also for the delays for the timely immunization. Val, we cannot hear you.
Sorry, it's already. Sorry, it's we as I've mentioned a while ago. We tried to do some regression to predict. To understand what predicts timeliness for coverage. Um, um, but I think it needs to be more than that. We need to understand the different domains of the system that would really explain it. But um, yes, we've already done those usual suspect of age, sex, socioeconomic status of the caregivers, etc. Or we've also checked if if place of birth, like those things would really predict timeliness. And we haven't included here, but we had that analysis. But yeah, maybe I could share to which in the next few days.
Yes, and
That detailed analysis, but we haven't really included here. So the regression model, because I think it will. I think I just want to emphasize some few points
yes,
on the
yes.
the estimates of the analysis.
And as you mentioned, this is part of a bigger study, and you are currently crunching the data for and analyzing it. And we will again invite our participants today when you hold another public seminar for the second part of this study. No? Yes. Our next question is from Mr. Josh Cesar Cirillo, who is the Children's Sectoral Representative from the National Anti-Poverty Commission. Mr. Cirillo, go ahead, please.
Hello, can you hear me, guys?
Yes.
Yes, sir.
Okay, good morning. Good afternoon, sir. So yung question ko ko naman is we saw the data that the sharp drop of immunizations during and after 2016 actually coincides with the spawning ng ating Dengvaxia scare, which was of course which was initiated back then by the public attorney's office under attorney Persida Acosta. So may I ask, is this incident a contributory factor into the declining incidence of EPI in the Philippines, not to mention the current crisis we're facing right now?
Empirically, it's really hard to we can do that. But remember that Dengvaxia, if I'm not mistaken, was 2016, 2017, right?
Yes.
And of course, it contributed to the decline, right? But to what extent, we need a deeper analysis. But I think when you look at the data, even in 2014, you would also already see decline in the vaccination coverage. In other words, the decline in coverage rate in the Philippines can be both driven by both demand side, and that's
Yes.
driven by vaccine hesitancy. And at the same time, there may be like perennial supply side issues, right?
Mm-hmm.
On how we actually deliver vaccines, right? Because we've seen decline even in 2013, 2014. So yeah, so both are valid, both valid reasons. But again, those are the things that we're trying to investigate in the next chapter, because I think it's important to look both sides, both the demand and supply side issues, right?
I see. Sir, can
Yeah.
I ask
I hope
a
I answered the
follow-up question?
Yeah. Globally, you would see vaccine hesitancy as a driver.
Yes, sir. Yes, sir. Sir, with regards to that, can I ask a follow-up question? Since with
Yes,
this, since you're considering that this can be a contributory factor, can we also add to the tools or one of the tools of the study, the parang yung what you call this, people's people's trust and understanding on vaccines, because as we are aware nowadays, the anti-vaccine movement has been on the rise within the recent years. So can we do that?
Yes, sir. We will both demand and supply side issues will be included in the more comprehensive assessment of the NIP, of the National Immunization Program.
Yes, sir.
Yeah, which includes trust. So we've already talked to DOH, because the DOH has this data on vaccine hesitancy. We plan to crunch more. We plan to do more analysis on that data set. I mean, there was a global survey also, which the Philippines was involved. So we could
Yes,
also
sir.
look into more in detail on that aspect.
Yes,
Yeah,
sir.
but I
And
mean, you're correct. I mean, yeah, that's
yes, sir.
very valid. I mean,
Mhm. And sir, Thank you for that, sir. And finally, one last question, sir. Because you mentioned earlier the Universal Healthcare Act po, di ba? And under the Universal Healthcare Act, we have a provision that the local government units have more free reign to procure materials or build facilities and even stockpile vaccines to cater their needs based on the applicability in their environment. So, how can this certain provision of the act can affect the institutionalization of public health initiatives and programs nationwide, especially yung EPI?
Um, that's a very good question. Even if you ask the Department of Health, I think we haven't really sorted out on how
Yes, sir.
we interface the EPI with the UHC law, right? But one thing is a possibility is that we shift the financing, right? Meaning that maybe PhilHealth will cover so that the
Yes, sir.
private sector will also be reimbursed, right? Um, but the question is that is there like in terms of procurement, we haven't really sorted that out. But because I think there is a monopoly in vaccine, it doesn't
Yes,
make
sir.
sense for each local government to buy their own, right? So
Yes,
maybe
sir.
there is really a pooled procurement by the national government, and the local government could just get it from there. But I think um, there should be, I think there needs to be a shift in financing, obviously, and um, but we really need to figure out how it should work, right?
Yes, sir.
And in terms of procurement, I still believe that there should be a national procuring entity because it's just too impossible for each LGU to procure, right? We, yeah, I mean many countries like did, like each state tried to bind together and procure as one entity because that's cheaper, that's more efficient, right? But those are the things that we need to think about as a country on how do we shift the way we finance, right, and the way we govern now API as we move to a more modern way of health system, right? But I don't know. Everything is stalled because of the
Yes, sir.
of the COVID. But yeah, I think that's a very very good question.
Yes, sir. Thank you, sir, for answering my questions. It has been informative. Thank you, sir.
Thank you very much, Mr. Cirilo. Now we go to the question of Yena. Yena, if you could also tell us your full name as well as your affiliation. Go ahead. Yena? Yena? Okay, I think we lost her. Okay, let's proceed first. We will go back to Yana. Let's listen first to the question of or comment of Dr. Roelano Briones of PIDS. Roel, please.
Yeah, thanks, Sheila, and thanks, Val, for that presentation. So I was about to ask something about recommendations, but I realized maybe I need to understand the situation in the field better. So what really triggers, in terms of timing, no? What really triggers the occasion for the decision to do the vaccination? Will it be entirely the initiative of the parents of the child to bring the child to the, say, barangay health clinic, knowing that the time for the vaccination is here? Or is it the decision of the health worker, say the BHW? They will do a daily scan or periodic scan of the list of their file of children in their area, and then identify their ages and say, oh, this is due for a vaccination. Second, if it's the latter scenario, how does that vaccine actually end up with the BHW? Does she then send up an order upwards? So in other words, I'm trying to find out where is the source of delay of the timing. If, as you have seen, no, that you have noted a delay. Is it because parents don't bring their children on time to the clinic? Is it because BHWs are unable to identify the children on time? Is it because even though they identify, when they send the order up, actually it takes time for the vaccine to arrive, and for so that the BHW can then administer the shot. So I'm sure this is a bit too much detail for your study, but I'd just like to know what is your sense from your exposure to the field. Over.
Thanks, Joel. Val,
Thank you,
please.
sir, for that question. So thank you for that question, sir. As you may know, it's highly devolved system, right? Like it depends on the local governments if they're aggressive or not, meaning that they still need to shell out money for immunization, meaning like they still need to pay some cost, right? So it's highly dependent on the local government. Some local governments are very aggressive, so it's dependent on on the health worker, right? Um, it's also highly dependent on the available supply, right? If the supply from the central office is delayed, even though the mother wants to be vaccinated, I mean, if she wants to be, or he or she wants the child to be vaccinated, if there's no supply, you would still encounter delays, right? So to answer your question, it's both, right? It's both demand and supply side, and it's really hard to tease out which one is the main driver at this point. Um, but I suspect it's both. I hope I answered your question. Did
Okay.
I, sir?
Okay. Thank you, Val. Now, I know. Let's go back to Jhanna if she is already around. Jhanna. Okay, probably she stepped out of the meeting already. I'll go back to her just to make sure that we did not miss her question. Okay, now let me call on Maylene Tepase Vasquez for her question. Maylene? Maylene, are you still there? Maylene? Maylene? Okay. It is possible that she's already stepped out or she can get through. So let me just read her question from our chat box. Okay, this is from
Excuse me.
Okay, Maylene, thank you. Please go ahead.
Uh, my name is Yena.
Oh,
I
Jhanna,
want
please.
to ask how to. Yes, thank you. How to immunize during a COVID-19 pandemic where the community must remain at home. Uh, how to get the target of immun, immu, immunize child during a COVID-19 pandemic? Apa?
Thank you, Jhanna. Jhanna, may we get your full name, please, and your affiliation?
From Health Polytechnic Palangkaraya.
Okay. Thank you. Thank you very much for joining us.
You're welcome.
Val?
Yeah, I'm not sure if I have the. Thank you, Yana, for that question. I'm not sure if I have. I'm good enough on this. I mean, to provide recommendations on how to vaccinate during pandemics. I'm not sure if the Department of Health have already issued a policy on how to do it during the time of threats or pandemics, right? In some LGUs, what they do is that they only allocate time for non-COVID patients or something like that. But um, I need to. It's really hard. I'm not sure on how to answer your question. But I think the Department of Health can be a policy on this, on how do you vaccinate your children during the time of pandemic.
Thank you, Val. Okay.
Yeah.
Okay. So let us now go to the question of Maylene Tepase Vasquez. Maylene, are you ready? Maylene? Hi.
Hi.
Hi, Maylene. your question, please, and may we know your affiliation?
Yes, I'm from Commission on Population and Development, Central Office,
Okay.
Office of Yusek Perez. So I would like to ask, okay, are there any strategies from our government to address the unmet need for the continuous immunization in the community during this pandemic COVID-19? Because I have been trying to research on if there are or if there is any guidelines pertaining to this unmet need, addressing this unmet need. Uh, uh, so is there any guidelines or protocol to address this? Can
Um,
you give me any department circular or department order regarding this one, please? Thank you so much.
Thank you,
um,
Maylene. Perhaps some of our participants, also representatives from the DOH, can help
yeah,
Val answer this
they might be
question.
they might be better to answer that. Um, but yeah, I think it's very important because I think the Department of Health, if I'm not mistaken, is already in public that there was really like decline in vaccination coverage in last March, an alarming level of vaccination coverage. Um, I heard it from one, I think it was a pronouncement. But I need to ask if there's already a policy on how to do it. Um, uh,
Okay.
how to continue the program during this time of pandemic. I think after this, I will try to contact the Department of Health if they have any issued any administrative order um, on, 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 on vaccination during the time of pandemic. So sorry, but it's really hard.
All
I'm
right,
not
sir. Thank
really.
you so much. Thank you so much.
Thank you, Val. Anyone from the Department of Health who is in our webinar today would like to add to that comment from Val? Well, you know better. Anyone? Okay. Perhaps later, if any of the representatives from the DOH would like to give their response. Okay.
Hello,
Let,
ma'am. Hello po,
yes,
ma'am.
yes, please,
Because
please.
for the moment, no, we're giving continuous family planning services
Opo.
in our grounds. So every time the parents or the mothers, would like to inquire regarding if we are giving vaccines, because I don't know, maybe one of the nearest health centers in the community, not available for giving the vaccine because of the pandemic now. So uh, uh, that's why I'm right now I want to have a point of clarification regarding the guidelines for this. Thank you so much, ma'am.
Thank you very much, ma'am. At we will also relay your concern po sa ating DOH. Okay.
Thank you,
Um,
ma'am. Thank you.
salamat po, ma'am. So we have a okay. We have a next question, and this is from Lidio, a certain Lidio. Lidio, are you
Yes,
still
good
around?
afternoon.
Yes, could you
Yeah, good
please
afternoon
tell
po.
us your give us your full name, also your affiliation? Thank
Yeah,
you.
I'm Pedro Espanyol, the Regional Director of POPCOM, NCR.
Thank you,
Yeah,
sir.
yeah, my concern is if we have data on upper region comparison, so we know which regions are performing well and which regions are not. No, for us to know exactly how can we improve our immunization coverage and timeliness. And just a comment about the possibility of the decrease in the immunization coverage. I think the scare on dengue has affected the coverage based on the 2018 data. And we're just happy to note that in 2019, there was an increase of almost 30% in the coverage. That was perhaps because of the campaign following the passage of the Kalusugan at Nutrisyon ng Magnanay Act. So in that campaign, it was emphasized that there are vaccine preventable diseases by which mothers should be conscious about bringing their babies to the nearest health centers for the vaccination. So I think that contributed a lot. But more importantly, I would like to know if just in case now we have some data on a per region basis, so we'll know exactly how we can improve our systems of vaccination. If in case we know exactly which regions are performing well, and of course which regions also are not. Thank you for the very comprehensive presentation.
Thank you.
From
Thank you very much, Regional Director Lidio Espanyol of POPCOM NCR. Val, please.
Yes, sir. We have regional estimates, so we could share it to you, so you can use it in your decision making. Yeah, we have regions to answer.
Thank you very much, sir. If you can share that, we're very happy.
We have regional estimates.
2018 and 2019, hopefully. Thank you.
Thank you very much, RD
Yeah, you can
Espanyol.
write me an email, sir, and I will email it to you.
Yes, sir. Thank you. Yeah.
Yes. Okay. We will share the email address of the author, Dr. Ulep, no? So to the participants. So in case you have other questions that you'd like to raise. Okay. Our next question is from Miss Cecilia Francisco, and she was referring to the availability of the slides used in this presentation. To all of you, we will be sharing the slides through our website. We will upload the slides, and you can easily download it from there. And we will also email all of you after this presentation, after this webinar, so you can get the URL. Okay. But in case Miss Francisco has a follow-up question, please, ma'am, if you're still around. Hello? Okay, she said that's it. Okay, I am currently looking at the chat box in case I missed any. Yes, Val, please. Val?
Hello, yes, ma'am.
Mm-hmm. Hello?
Was there a question?
No.
Was there a question, ma'am?
No, there was nothing in particular. Miss Francisco was just asking for the availability of the slides, which we said we will share through our website. Okay.
Opo, yes, ma'am.
Okay. There is a comment here from Maan. And she said maybe the ratio, I think this is related to the earlier question on the reasons for this declining vaccination. And she said that maybe the ratio of healthcare workers to the number of population is also a factor. Okay, I think we have already accommodated all the questions. And so at this point, folks, if there are no more questions, please join me in thanking our speaker for his very comprehensive and his very enlightening presentation. Please join me in giving him a and of course Ms. Jhanna Uy, his co-author, a virtual clap. That's all we can do for now, a virtual clap. And of course, thank you to all of you for your presence and for your active participation in this open forum. So just to wrap up, so it's important that we should not lose sight of this very critical public health issue on the timeliness of health vaccination among children. so we can prevent the resurgence of vaccine preventable diseases. So at this point, I'd like to call on our President, Dr. Celia Reyes, in case he has any final remarks. Ma'am Cel?
Yes, thank you, Sheila. Thank you, everyone, for your active participation. I think we all gained a lot in this exchange of ideas, and we look forward to having you in our next webinar. We're going to be having weekly webinars, and Sheila has lined up several over the next few weeks. So we hope that you can again attend them, and if you have also specific requests, as Sheila's mentioned, she'll be from the presenters. Just let us know, and we'll be sharing all the materials that we have. Again, thank you, everyone.
Thank you very much, Ma'am Cel. So before we close, just a few reminders. Again, we will share with you a copy of the PowerPoint presentation. So just visit our website, particularly our events page, and we will post there the full PowerPoint presentation delivered by Dr. Ulep. Okay, so in addition, we would like to know your comments and your suggestions on how we can improve our webinars. Thank you to all those who responded to our survey, to our feedback survey for the first webinar. So for this webinar, we will again be distributing our feedback survey. So in case you missed the URL, which is flashed on your screen, don't you worry, because we will again email you the link. And finally, please don't forget to follow us on our social media pages. We have our website, that's pids.gov.ph. We also have our social media accounts on Facebook and Twitter. So this ends our webinar for this week. We hope to see you again in our future events here at PIDS, whether electronically, whether online or face-to-face. But for now, we will do this webinars instead of the face-to-face ones. Thank you so much, and stay safe and stay healthy. Maraming salamat po.